primary biliary cirrhosis, PBC. It also known as primary biliary cholangitis. It is an autoimmune disease where bile ducts in the liver are slowly destroyed. The causes of TBC is not clear. It's probably due to the combination of genetic, autoimmune, environmental, or microbiome. The people who are at risk is range between 30 to 60 years old, usually women prone to get TBC. Genetic factors are also one of the contributors where a person has higher chances to get TBC when they have family history of this disease. People in the Northern Europe and North America have high risk. Environmental factors such as smoking, toxic chemicals, and infection are also one of the risk factors.
Symptoms, which are early and late symptoms. For early symptoms, the patient will feel fatigue, itchiness, and dry eyes and mouth. For late symptoms, the patient might get edema, jaundice, xanthomas, which is a disorder where there is abnormal storage of fat in many parts of the body, musculoskeletal pain, swelling of the spleen, and pain in the upper right abdomen. Some of the complications that the patient might get after acquiring the disease are liver cancer, osteoporosis, liver cirrhosis, portal hypertension, and enlarged spleen are also known as splenomegaly.
Diagnostic tests for primary biliary cirrhosis are blood tests, which is the laboratory analysis that can be used to detect the level of total protein, albumin, bilirubin, and others. Second is ultrasound that use high-frequency sound wave to create image of the inside of the body. Third is the liver histology, where we can observe tissues under microscope. Next, antimitochondrial antibodies AMA test that can be used to identify elevated level of these antibodies in blood. This test is most often used to detect an autoimmune condition such as primary biliary cirrhosis. Besides, we can also use magnetic resonance elastography or MRE, which is the imaging test which produces detailed pictures of organs. It may help doctors to diagnose inflammation, bleeding, obstruction, and other problems. It is non-invasive and does not use ionizing radiation. The last test that can be used for PBC is magnetic resonance cholangiopancreatography (MRCP), which is a specialized MRI exam that evaluates the hepatobiliary and pancreatic systems, including the liver, gallbladder, bile duct, pancreas, and pancreatic duct. It can be used to find the cause of pancreatitis or diagnose and explain abdominal pain. Additionally, MRCP is a less invasive alternative to ERCP, which is endoscopic retrograde cholangiopancreatography, a procedure that uses an endoscope combined with an IV injection of X-ray, contrast dye, and fluoroscopy X-ray image. Treatments for PBC are ursodeoxycholic acid UDCA, obeticholic acid or Ocaliva, fibrate or Tricor, and liver transplant. That's all from us. Thank you for watching. Bye.